Good evening and welcome to the November 6th work group meeting of the Oregon Public Defense Commission. I'm Jennifer Nash, chair of the commission for now, for 6 more weeks or so. So let's go ahead and dive right in. We have a couple of briefings and then an update and discussion about a few items. The briefings are about the comprehensive, well, Lisa's not here yet. So let's, Kim is here. So let's just do the update and discussion about the key performance metrics. Since you are here, you're on the hot seat, Kim. We'll just jump right to you. And I'll just turn it over to you.
Okay. Well, welcome everyone. For the record, I'm Kim Freeman. I'm the Compliance Audit and Performance Manager. We did brief key performance measures for the 27-29 biennium, or proposed key performance measures at our last meeting in October, but we were not able to complete all of our conversations. So I thought tonight I will just do a quick recap. So we kind of know where we were, a little bit of the conversation, and then move on to where we left off, if that's okay with the commission. Okay, perfect.
Sure.
Next slide, Mara, please. Next one. So these are our 27-29 proposed key performance measures, and these ones are the ones that are remaining for 2026. So we're keeping our appellate case processing, our customer service metric, and this is our customer service survey. So no matter what key performance measures we change, we always need to have a customer service survey and component to our key performance measures. We are going to keep our best practice for boards and commissions, and that is Vice Chair Mandenberg's project, and I know she's going to talk about that as well, not tonight, but later. But we are keeping that key performance measure. We are removing our key performance measure in reference to trial level representation. This particular one was in reference to continuing learning education for our contract attorneys. This KPM, the language conflicts with our contract, and it also conflicts with the requirements for the Oregon State Bar. Oh, and I see Commissioner Knabb has his hand up. Sorry.
Thank you.
So
no,
let me know, because I may not be looking at my screen.
No, I appreciate it. I just wanted to know, you said that there had to be a customer service survey as part of the KPM.
Mm-hmm.
Is that statutory, or is that where does that come from, that requirement?
Thank you for the question, Commissioner Knabb. I should know if it's statutory. I just know when I have reviewed all the KPM requirements that are on the legislative website, the customer service survey is one that's always there. It's a requirement in our KPM.
It's a requirement for the executive branch, certainly. And I would imagine that means it's also a requirement from the legislature, but it is for every executive branch agency, they have to have a customer service survey.
Okay.
And
Thanks.
what we have done in the past is we have kept our questions the same, because there are 6 questions we need to ask. But what we've done over the last 2 years is we've expanded what I call demographic information. So we're asking more about are you one of our contract attorneys? Are you one of our hourly attorneys? How long have you been employed in the public defense workforce? We've been adding some more demographics so we can understand whom is taking our survey. So we've added more of those to the survey, but we've kept the questions the same. And then this survey, we added 3 opportunities for our providers, contractors, everyone we surveyed, to give us 3 suggestions on how we could improve our customer service. So they had 3 opportunities to provide us additional feedback.
And I'm just sorry, I don't mean to take up more space, but has there ever been any thought about engaging with individuals who receive public defense services as the customer rather than the public defense provider?
We have had those conversations internally, especially with the information that we have from our Oregon Trial Division with our Clio case management system, we're not there yet. I think it's a good piece of feedback that we are missing in looking at performance from our providers, looking to ensure that the person whom is eligible for a court-appointed counsel is receiving the quality of representation that they feel is meeting their needs. So I'm happy to add that to our list and see how we could incorporate that.
I mean, I certainly think it's worth considering, if we're looking at, performance metrics. It seems to me like individuals receiving public defense services, it should be more of the target, than maybe attorneys providing services. But that's just my thought. And I know I derailed it, so I'll just go on mute now. Sorry.
No, it's perfect. I appreciate the questions. Thank you. Okay, next slide, Mara. Okay, number 4, or here's our parent-child representation program. This one, our key measure has been low in the last several years. We want to look at having a different metric. So we talked a little bit about that last time. And some of the things that we talked about were looking at the effort of the attorney, because right now it's time spent, but also adding, phone calls, the conversations with Department of Human Services, kids, making sure they stay out of foster care, how many meetings to advocate for your client, looking at other services. That was some of the conversation we had at our last meeting. Some of the items that we are currently capturing in our caseload reporting, and this is our caseload reports that we get from our PCRP attorneys, are reunification rates, guardianship, child under the care of a relative, and reliance on foster care. So those are some current metrics that we are currently measuring. And so we can add one of those metrics here, because in the KPM document, we have one metric for each one. So if we wanted to measure different metrics in the PCRP program, we would have to have a PCRP metric for like reunification, one specifically for guardianship. I can't lump them all into one KPM. It would be a little hard to do that. We could have additional KPMs for PCRP, more than one, but we can have that, conversation once I get through everything. So those are some things that we're capturing now, and we have, rates to look at to have a metric where to start from there.
Is that a metric or is that a placement? Those sound like, so one of the things that has to be reported in the PCRP reports is where the child is placed. And those seem to me to be like the options of where the child is rather than a metric for the case. So they're either in a guardianship or they're in foster care or the place with a parent, or those are like the places where the kids are, right? That's not a metric per se, is it?
Correct, Chair Nash.
Okay.
It is one thing that we are measuring. So we do have a measurement of where the youth or the child is placed. Yes.
Okay. That makes sense. Thank you.
Okay, sure. And then our next one, which is a new key performance measure for 2026, is the percent of financially eligible individuals receiving a public defender with a target of 100%. This one is related to individuals who are identified as unrepresented by the courts, reflected in the Oregon Judicial Department, the OJD unrepresented dashboard. This one, we've talked about how, what's the measure on the list, right? And again, this is for criminal, juvenile, and post disposition relief. Currently, we have 7 days if they're on the bet chart list. We also talked about we need to identify the person eligible that's been appointed their first attorney in case there's conflicts. So we've talked a lot about different measures there. We need to look at across counties, right? Because if they have cases in multiple counties, how do we represent that correctly? So you have, you may be unrep in one county, in custody in another. So there's still some things we need to work out on this one specifically. Next slide, Mara. And then these are some additional ones that we talked a little bit about last time. This is a percent of timelines for key department activities. This one is a metric that's currently used at the Department of Consumer and Business Services, and they're measuring their performance around streamlining processes and expansion of technology. So what we talked about last time is, could we use this to look at our agency creations of policies and procedures, operational guidance? What I heard from the commission at our previous meeting was we need to come up in general with more concrete KPMs. What story do we really want to tell? And we shouldn't be rushing the work to meet like this particular metric. So this may be a metric that we don't look at. Some of the other comments received are, what happens if we have a staff reduction? And why is this metric important? So again, when I was looking at other KPMs, I was trying to see what other agencies are using for key performance measures, and if there was ones that we could potentially adopt here at OPDC. So again, we can have more conversations when I get through everything. The next one is percentage of OPDC contracts that meet or exceed 75% of the contract requirements. This is where we left off last month. So this particular metric does come from the Criminal Justice Commission. This metric is in reference to their grant administration. And I would, if we were to impose this one or approve this one, I would look at it for all of our contracts. So it's not just our contracts for our nonprofit public defender's office or our consortium, but these are all contracts within OPDC. So we do have some personal service contracts. So any contract that OPDC had would fall and need to adhere to 75% or more of the contract requirements.
So I have a concern about that because we expect 100% adherence to contract requirements.
Yes.
And do we open ourselves up to waiving specific performance or some kind of performance by measuring whether or not someone's meeting 75% or more? I mean, I don't know the answer to that, but I have a concern about that. And then also, if we're requiring a different MAC number in the contract, then we should really make sure that that number is consistent in the KPM, so there isn't a misunderstanding about what we're actually measuring. Because if people, I mean, I could see them saying, oh, you just mean that we only have to meet 75% of our caseload, as opposed to. So I think that we have to be really careful about how we do that, is kind of my thought. Commissioner Leininger.
Thanks very much for this presentation, Ms. Freeman. I'm sorry I'm a little slow on the draw, but I wanted to go back to the last bullet point, and I'm one of the people who was concerned about using as a metric for our efficiency the time span between the commencement of policy development and the completion of policy development. I worry that that's at odds with our other goal of widespread involvement and opportunity for comment when we're doing policymaking. But I did see your last subpoint here as other key deliverables, and I wondered if I could just ask you to maybe provide some more examples of deliverables, and maybe for some of these others, my concern wouldn't apply. So I'm open-minded about timelines. I just wonder what the other deliverables might be. It seems to me that if they involve public consultation, I wouldn't really want to rush, but perhaps there are other timelines we should scrutinize and see if we can, measure time as a metric of our success.
Oh, thank you, Commissioner Leininger. for me, and maybe I see Director Sandrigan has his hand up too, so I'm not sure if he wants to come on this or on the contract one, so I just want to.
I had planned to comment on the contract one.
Okay, okay. For other deliverables, I guess under so much of the agency and what we're doing is establishing processes and procedures, is why that one is high on a list for the agency. Other key deliverables could be, I mean, if we don't do percentage of contracts, we could look at some other deliverables around contracts, around internal auditing performance. I think there's a lot of potentially some other deliverables, I guess, because where I see some of our areas of highest risk is around policies and establishing procedures for the entire agency. And I don't see that as something we could rush, because from the policies that we have implemented within the agency, we've also established an internal process document and or created additional forms to go along. So it isn't just policy creation, but it's also the process and any form creation, or totally revamping a process or policy altogether. And I'm going to use our internal travel policy. We just totally revamped it, created a process guide. We have a wonderful Excel workbook to be used. Not that we're doing a bunch of travel. I just want to make sure that's clear, but we have revamped the whole travel policy to make it easier, one, for our staff who is traveling or attending conferences, manager approval, and most importantly, when all the information gets submitted to our accounts payable department and our accounting department to pay that in a timely manner. So do you have specific feedback from a commission member perspective of a deliverable that you would like to see?
Oh, I'm just thinking aloud. I wondered if, our list of possible budget cuts to comply with the 5% figure or something like that. But again, I do have a concern about rushing things. I think we're a deliberative body. We now have a bigger number of members. We have a lot of stakeholders that want to be heard. So I don't know. Thank you for your response.
Maybe AP and PAE. That could be where other key deliverable would be. They're concrete, like how many days for processing PAE requests, how many days for payment of invoices. That seems like a good place for that to go if we were going to measure that. And that's a concrete thing that you could measure.
And we did have that comment at our last meeting to add payment times to process invoice to measure that. And we could put the PAE invoice or PAE submission and approval time as well.
And I'll jump in really briefly just on the contracts discussion. I agree, Chair, that 75% is low. And I'm just providing the comment because at CJC, 75% was great, but you're right, nobody really ever paid attention to that by the time we got to really discussing the outcome. Because the outcome was just what was the percent that met that percent, and usually that was 100%. But I think that proposing a new KPM that has the equivalent of a C grade is not probably what we want to do. But I would maybe suggest that we want to set it at like 95%. And maybe what we should do in addition to that, though, is actually lay out more than just saying contract requirements. It would be like contract requirements, including MAC utilization, data reporting. And the data reporting is where I would mostly think that I recognize that some of our contractors are sometimes late, and so I would hate their lateness and the grace that we might be willing to give them, especially around holidays or other times for data reporting to result in our KPMs going down if we're holding ourselves to 100%. requirement. So that would just be my one thought. Maybe we set the bar pretty high, but maybe 100% is a little too high. But on the other hand, I would feel comfortable if we had a 100% goal and we only met at 95% because of the reason I just stated. I could stand in front of the legislature and I would just be upfront that, sometimes data reporting is a few days late, and here's the number of contracts where it was late and that was the main cause. So I'd be comfortable either way, but just wanted to provide that feedback.
Commissioner Nav?
Thank you. I wanted to chime in as well, just to say that I thought a 75% contract requirements just seems like not a very helpful figure. And I guess I had a bigger question of, do these have to be internal agency process and procedures, or can we kind of look outward to the work that the agency is supposed to be enabling? And so, I think something that is more along those lines is the payment times. But number of cases that that council has provided assistance on more than X cases, and because I know there are resource councils at the agency, but can we connect this to the work more directly? Because frankly, like, whether or not we develop processes and procedures for travel allotments, I know that's really the day-to-day important, but it doesn't tell people who we are and what we do. And so, connecting it to what we do as, what the end goal of the agency is, which is to provide zealous public defense and representation. How do we do that? We do that by providing technical assistance. We do that by implementing standards and having contractors adhere to it. So what are those processes, and how can we quantify those? Is it a number of people that get that assistance? And so I would hope that we look outside of key department activities and look to more substantive work that the agency does.
We have a strategic plan, and in that strategic plan, there were goals. And some of those goals were shorter term goals. Some of those goals were longer term goals. One of the shorter term goals, of course, was transitioning to and fully integrating into the executive branch. Some of the longer term goals are, much longer term that I can't remember off the top of my head. But it makes sense, I think, for us to look at our strategic plan and to develop KPMs around our strategic planning. We have a mission statement, and then we have specific goals. And if I recall correctly, there are like 5 of them. And so it would be good for us to circle back around and integrate those goals into our KPMs, I think, or at least link those. That's why we developed the strategic plan, and it makes sense. And that really is, to Commissioner Nab's point, kind of our outward facing. This is what our agency identity is. This is what our goal is. This is what we're always striving to be. And it makes sense to do that.
Thank you. Okay, Mara, next slide. The next KPM here is the percentage of the Oregon Public Trial, so OTD, Oregon Trial Division, clients who report they feel more confident in their ability to improve their current circumstances because of working with a case manager. This particular KPM is something that is used with Department of Human Services on their self-sufficiency program. And they have a survey for participants who report they feel more confident in their ability to improve their current circumstances because they were connected to resources. So with our current Oregon Trial Division, we do have a case management system called Clio. We are currently tracking with our case managers that we have on staff what services one of our particular clients needs, so we can track all the services that are needed, and we can also track when they are connected to services. So if they need 5 different services, maybe it's housing, maybe it's SNAP benefits, it could be medical, it could be mental health counseling, it could be whatever services are needed. We track those, and we also track when they are connected and utilize those particular services. We could also do an exit survey. This kind of goes to the conversation earlier about conducting surveys to the clients that we serve. This would be something we could look at, and then send surveys out when cases are closed within the office if we have the measure to communicate with someone for a survey to be returned. That one may be a little more labor intensive as far as sending a survey, but once we have it all, automated, it could go out and the survey results can come back in, but it would be something that would take a little bit of work to develop from both sides internally here and then also on the Oregon Trial Division, but it would be a good way to measure how our clients are feeling with extended services to help them through their case.
I like that. I think it's a good thing for us to know, but my concern is that it's not part of our core function. And so, and I also, if we end up in a budget situation where we're looking to, where the legislature, not us, is looking to cull services to provide core services only, I imagine case managers might be one of the things that would go. And then we have a KPM that's measuring something that we no longer have. And also, it's hard to, I don't know what feel more confident is in terms of data. I like KPMs that have very clear data, and it's hard to, something that's kind of hard to quantify. But my bigger concern is just about using a KPM for case manager, especially for criminal cases. Dependency that, the legislature might be more hesitant to cut those before they cut them from criminal, but I would think that might be something that we might not have if push comes to shove. So that's what my concern is about that one.
Thank you.
Sorry, I hope we don't sound like we're just
No.
leaning on your.
No, this is all great. Thank you. This
Okay.
is the part of the conversation that we need to have. It's great. Okay, Mara, I think we have one more slide.
I just have a quick question or comment on the last slide, which I tend to agree that I think that certainly I think there could be a very good KPM with the amount of referrals or like quantitative number of referrals, but the reality is that public defense clients are in a very different circumstance than other folks who are receiving social service case service work, and so you're going to have a disparate engagement and experience from those individuals. So I don't think that I do think that to the extent that that there's a way to measure the services in terms of quantifying the numbers of referrals or individuals receiving, and again, this is where someone who's really in the weeds would be the very best to tell us what is an appropriate measure. But to the extent that the case managers themselves identify something that is a metric of their own success, like the number of referrals or individuals receiving new benefits, I think that could be a meaningful statistic and something that lays the foundation for integrating additional resources within public defense and using the public defense moment as an opportunity to access services and triage crisis. So, I think that I would certainly want to think more about whether there's anything in that space that could be an appropriate KPM. But I think that folks who are a little closer to the ground are going to be the ones who are better at telling us. That's it.
Thank you. And so the last one proposed is to hire and retain state trial level public defense attorneys. And this is from our Senate Bill 337. and this is the language right out of the bill, by January 1 of 2031, at least 20% of all appointed counsel at trial level must be attorneys employed by OPDC. And then we have our metric or measure at 2035. I believe we had some just brief conversation around this one where, yes, this is, mandated in Senate Bill 337. But as I've heard several comments, and we all know we're currently in tight budget times, and we're looking at, proposed budget cuts here at the agency and statewide. And, how do we potentially measure something that we may not be able to do based on, current financial constraints of the state in general, but this definitely is something that we are required to do. We have a metric here, and so this is why this one is listed as a proposed KPM.
I think it's great because, I mean, we're required to do it. If we don't have the funding for it, the legislature needs to know that every single year, this is what you've required us to do. We don't have the funding for it. This is what you've required us to do. And so they either need to change the number of attorneys that have been required, the percentage in Senate Bill 337 to conform with budget, or the budget needs to conform with the requirements of 337. So I think having that, my opinion is having that as a metric is very important. What percent, and then the question would be what percentage, with the goal being by 2031 and 2035 that it's got to be 20 and 30%. But 30%. I think that's great. I think this should be a KPM. That's my opinion.
Okay.
I don't know what others think. Commissioner Leininger says yes.
I wonder whether there's a way to capture. So the question I have, and I agree with everything you said, Jennifer, the question I have is, how does the legislature know that the reason we're not meeting the goals that are set in SB 337 is because of the budget? So, unless they were to read comments, if there were comments that explained the data, and I don't know, Kim can answer, of course, how whether it's true to add comments to explain the data, but if it's not, I wonder if there's a way to capture something like what percentage of the budget the legislature allocated for state trial level public defense we are spending. I mean, something that would be an actual data point that would show that we are both not meeting the goal and spending every penny that the legislature has given us, but we're still not meeting the goal.
Well, we get position authority. I mean, this is a little easier to measure because there's position authority from the legislature. So there's actual, like, we've budgeted for 27 lawyers or whatever. So, I mean, in this one, it seems like it's, and of the 27 lawyers, that represents such and such amount of MAC, and the total amount of MAC we have is this. So it's I think it's
Right.
an easy, yeah.
So finding some way to capture that relationship, I think is as important as saying how close we are to meeting the goals.
Yeah.
Okay. Okay.
All right.
I do want to, I know I think I'm over my time, so I just want to thank you. I took additional notes from our conversation today, and we will be back in December with some very key established metrics and looking at the strategic plan. I heard look at adding payment processing times, PAE approval and submission, number of cases counsel has provided, and looking at adding a survey to our clients for a metric for customer service, and not only surveying our providers that we provide payments to.
Yeah, that sounds good. Thank you.
Okay, perfect. Thank
That
you.
sounds great. Thank you. All right, so moving on next to a briefing from Ms. Taylor about the Comprehensive Public Defense Report. And I will just key this up a little bit, or tee this up, not key this up, and say that Ms. Taylor has provided a draft of the Comprehensive Public Defense Report to the Executive Director, who's in the process of revising that. And so the discussion today is really just going to be kind of at a high level of what generally speaking will be in the report, and then we will actually see the report at our meeting. That's a fully edited, fully ready to go report at our commission meeting in 2 weeks. So with that, Ms. Taylor, take it away. Oh, we can't hear you. You are unmuted, but we can't hear you.
If I speak loudly, can you hear me?
Well, you just came online now. Now we can hear you. Oh, no, now we can't hear you again. I think it's a microphone problem.
Frozen, maybe I froze. Sorry, can you hear me now?
Yes.
Okay, great. Glad this is going so well. Let me go ahead and share my screen.
Actually, you're coming through really kind of muffled. Do you have?
Yeah, here.
Yeah.
headphones.
Can't hear you. We could see you talking, but can't hear you.
Have you? Hopefully that will work here.
Ah, I think you're
Is
there.
this better?
Oh, yes, there you are.
Oh, great. Okay, fantastic. Great. Well, thank you, Lisa Taylor, Government Relations Manager. I hope you can see the presentation.
Yeah.
Great.
Yes.
Okay. Well, so this is a presentation about not just the comprehensive report, but also the status report, which is due on the same timeline.
Right.
But as you see from the presentation, they're very similar. So I'm just going to go over the report overview, then discuss kind of the report sections that are going to be included, and then just some discussion time for feedback and highlights from the commission. Though while I'm talking, if you guys have questions, please jump in, especially if I don't notice your hand up. So starting out here, we have our status report. This is the report that is due to LFO on December 8th. So it will be coming to you again at the December meeting on the 5th for your approval. And it's being turned into LFO and the Legislative Fiscal Office for the Ways and Means Committee. And it will be heard during the January legislative days by the Public Safety Subcommittee. Those days are January 13th through the 15th. I don't know.
I want to
Oh, yep.
jump in. No, that's okay. I was just gonna say, I want to correct you. You are reminding me. I've said this so many times and I'm wrong. We're not going to see this in November. We're going to see this at our December meeting. So I'm sorry. I keep saying November and I'm wrong. We're going to see it at our December meeting. Go ahead, Ms. Taylor.
Yep, absolutely. Again, I don't know if we'll be asked to present or anything during the January legislative days, but during that time, they will accept the fact that they received the report. The legislature will. This report requires us to provide an unrepresented update, which includes an update of the 12-month unrepresented plan, which Director Sanchagrin submitted to the governor back in June. It also asks for agency operations, including planning efforts, and changes to the service delivery model, including by provider type, forecasted versus actual caseloads, and cost factors such as the cost per case, and finally, a biennial financial forecast. The other report is our comprehensive report. You've already seen a comprehensive report. We submitted one back in May of 2024 and then again in December of 2024. So this is an update well, it's much more than an update to that report, but we've already submitted a comprehensive report. This will technically be the third iteration. And that report is due to the Judiciary Committee. We'll be turning it in again on 12/5. And the report asks for how the commission plans to provide public defense services, including financial projections based on workload, public defense method proposal based on workload, updates on training and supervision, discussion of how the hourly rate was determined, and then discussion about oversight and enforcement standards. All of these report topics and even the subtopics that fall under them kind of fit into these four main categories. That would be the unrepresented, agency operations, providers and caseloads, and financial forecasts. So when you're thinking about this report, those are kind of the areas that we'll be discussing. There's also a lot of cross pollination with all of these reports. They are very similar topics, and I'm really organizing this to make sure that both reports are saying the same thing where appropriate. It's really important that we're making sure that our reports are consistent and that we're providing the same information. The reports are going to different committees and different staff, but a lot of the members sit on both committees. So we've been putting significant focus into making sure that all of the data matches and everything is consistent across both reports. So this is our report process. I initially interviewed the subject matter experts, or SMEs, to develop the initial draft, and then those SMEs reviewed and edited those drafts, and the drafts and the data requests were made. Now we're in the final drafting stage, which has been sent to Director Sanchagrin for line editing. The data is being finalized, and this is also the stage where we're bringing you, the commission, in. So I'm really hoping to get your feedback on topics discussed today. I want to know if you believe we're highlighting the right things, sharing the right data, or missing key elements. As SMEs, the agency can kind of get bogged down in details, and as a commission, I think you guys have a really good high-level view of things. So next week, Director Sanchagrin and I will work to incorporate your feedback as we finalize this report. The final data will be added, and the report will be submitted to the commission materials before the 12/5 meeting. And at that meeting, we'll be requesting your final approval. So the first section of this report, of the status report, is an unrepresented update. And this update is kind of a briefer version of the unrepresented analysis that Director Sanchagrin provided in the June report. The highlights include a substantial reduction in the pretrial out of custody numbers over the last 12 months, as you can see in the chart. Unrepresented individuals are now below 3,000, which is actually the lowest numbers we've seen since, I believe, the end of May 2024. Let's see, COOS is actually, as of October 31st, at 0 in custody and only 1 out of custody unrepresented person. And Marion Jackson numbers are also significantly down year over year. We then go into a county analysis where we provide specific analysis about the 6 crisis counties, descriptions of trends, and highlights of interventions that we've seen in those counties. And this provides you an example of the data that we're providing for each of those county analysis. This is Coos County, and you can see we provide the data year over year in that table, and then also the trend lines for both in custody and out of custody pretrial individuals. Then we move in for the status report to an update to the 12-month plan. You can see the 7 interventions here that Director Sanchagrin included in his June report to the governor. And the update really just provides an update to how these interventions are going. We try and provide data wherever possible in these issues. For example, like the early resolution dockets, we have quite a bit of data, like for example, the Jackson early resolution docket, which takes cases at arraignment, preventing them from going onto the unrepresented list. It's a weekly docket, and it's resolved 147 cases since May of 2025. So that's 147 cases in Jackson County that never made it to the unrepresented list. We also have data on the enhanced MAC program. That's the 115% program. the reduced caseloads for new attorneys. We have data on how many attorneys are participating in that. Cohort hiring, which we will have a December amendment, which will add a cohort of newly barred attorneys. There's probably a better word than barred. They haven't been barred from practicing law, but they're new attorneys. And then we have quite a bit of data about our Oregon trial division and the work that they've done on unrepresented. We then move into agency operations. And the status report requires an update on the agency operations, and these operations mainly focus on the implementation of the Compliance Audit and Performance Division, or CAP.
Lisa, before you
Yes.
move on, I have a question about the unrepresented. Are we, when we talk about how the numbers are down and specifically in, different counties, are we giving any kind of analysis as to why we think that's the case, or are we simply providing the data?
We're providing, we provide why we think that's the case, specifically if there's interventions we can point to. So a lot of the interventions that we're pointing to are the early resolution dockets, and I see the director has his hand up. We might have more.
Go ahead, Ken. You're muted.
For some reason, I've had to double click my unmute button all afternoon. I wasn't trying to interrupt, but I was just going to say that exactly what Lisa was saying, but I thought maybe a good way to explain it is if you recall the email that I sent to the commission, I believe it was a couple months ago when we were talking about reductions in Marion County. That's what we've attempted to do for each county. And so, it's not pages and pages of analysis, but at the same time, it tries to look from a data-driven perspective or from, what other dynamics are happening within the given jurisdiction to really describe what we think is driving some of these numbers. And so I think Marion County is a good example as well. I've tried to partner with the courts because we know that some of the docketing practices that they have changed in Marion County as well have led to some of the reductions. So just to make sure that we're aligned with our stakeholders and giving credit where credit's due. Sometimes it's the trial division, sometimes it's providers, sometimes it's collaborations between multiple system partners. So yes, I think it will provide a good high-level roadmap for what's been working in different counties and which counties we have more work to do in.
Great, thank you.
So the update about the Compliance Audit and Performance Division is really just an update about our development of that program to strengthen oversight and accountability and improve transparency across the public defense system. We're also providing updates on these other areas, policy and rulemaking, which has come really far in the agency, especially with our move to the executive branch. As you can see here, under policies, we adopted 12 in 2024, and we've adopted 89 policies, I believe, this year. So it's made significant improvements. If the policy team is listening, those numbers may change, so please don't hold me to those. Next, we move into our providers. This is really covered in both reports. We're providing kind of an explanation of the different provider types that we have, the contractors, Oregon Trial Division, and our hourly attorneys. And these sections include data on the numbers of providers, the structures of the different provider types, and the development of the hourly panel. And we also discuss standards and qualifications. As you all know, you've adopted a lot of performance standards and qualification standards over this past year, and we just have a discussion in there about how we got to those standards and qualifications and what future work looks like in that area. Moving on from providers, we get into the cost factors. So the status report reads that the report should also include information on changes to the service delivery model by provider type, forecasted versus actual caseload, cost factors, including cost per case, and biennial financial forecast. This covers a lot of information, so please jump in if I'm going too fast or you have questions. But as you can see here, we kind of cover these cost factors. And so for providers, we're going to provide an updated table that shows the total contracted MAC by provider type. You can see a summary table here. Data is currently updating the contracts database with the latest data from the October contracts that started. So I don't actually have numbers to show you, but this is sort of the summary of what that graph will look like. Then we talk, oh, yep.
I was just gonna say, is the financial projection going to include what we are allocated or what we need and don't have?
The financial projections will be based on what we have. So what we've been given by the legislature, broken up into, you know, who's taking the cases that are forecasted and how are those cases being paid for. And
Because we know we have a shortfall that we have to make up somehow for court mandated expenses and PAE. So, because that's not, I mean, the way it's described there, the biennial projection, the estimated total cost to deliver services is more than the allocated money that we have.
And my last couple of slides are going to talk about the differences here, but
Okay.
I can go ahead and just cover
Well,
that now.
That's okay. If you're going to, no, if you're
Okay.
going to cover it, that's fine. Thanks.
Okay. Great. And we then have, actually, let me just move forward here because I covered these all. So this is another example of how we're going to lay out those provider numbers. This type of chart is actually also provided in our remediation reports that we did all of the last year that you all approved. And so we're just going to redo these charts with the updated numbers from our current contract cycle. And these numbers provide a really good baseline for us to go back to and show the legislature of like, oh, we've contracted with more, you know, level 3 attorneys because we saw a lot of high felonies or, you know, whatever it is. And then our caseloads here, caseloads is a little bit of an interesting area because it wants us to show caseloads actuals versus forecasted. And we're obviously 3 months into our forecasted biennium, technically 4, but we only have reports through 3. So what I'm kind of thinking, and I'm still talking to data and budget about this, is we could do a retrospective from the last biennium of how many cases our providers took. This is that top graph, and that's an example that was in the remediation reports. I think this is a useful chart just to show the work that's being done by our providers, because I mean, it's a substantial amount of work. You know, this wasn't even a full biennium, and you know, they were almost at 93,000. Like, that's a lot of cases. And then we could also provide them the forecasted versus actuals with just the first 3 months of data that we have available.
I think that makes a lot of sense to compare last biennium, because that's really what the legislature wants to know. So to compare the last biennium to now, I mean, you could just add the third column and then just do the 3 months that we have currently.
That's true.
But yeah, I would put them side by side. So, you know, the appointments from the last biennium, the forecasted caseload for this biennium, and then what's been taken so far. So
Yeah.
then you just have them right there next to each
It's
other.
one chart. I like that idea.
Yeah.
Thank you. Great. And then we have the cost factors. Again, the status of the report specifically requires that we provide them with cost per case information. So I know you guys received a presentation about that, and you know, it was a preliminary cost per case. So we are going to make sure that that's really clear when we present this information, is that this is a new analysis comparing different provider types and their costs and the different case type costs, and that this is our first comprehensive cost per case study, and it's something we're going to build on. And then finally, this is the financial projections conversation. The two reports ask for financial forecasts, but they ask for them differently. The comprehensive report asks for financial projections based on caseload, whereas a status report is requesting biennial financial forecast. They do sound the same, but I really do think that they're kind of different. I think that the financial projections based on caseload, what I've taken that to mean is that they want to know how many cases are projected to happen based on the forecast, who's going to be covering those. So is Oregon Trial Division going to be taking some, contractors are going to be taking some, and how much is that all going to cost from the agency? And I've been thinking about it and talking to budget about it in terms of how much have we been budgeted and how are we allocating those funds to cover that workload that we anticipate. I'm happy to hear a discussion about different ways to present that, but that's how I've been moving forward so far. And then biennial financial forecasts, I think these are much more of like the budget updates that you receive at your commission meetings, the agency as a whole, how we're moving forward.
I think the one thing that I would like to see, and I don't know where the good place for it is, but somewhere in the, not so much the status report, but the comprehensive public defense report, is a discussion about the MAC motto and how it's inadequate to cover this, the caseload, how we need to switch to a, however we want to call it, a time-based FTE type, and talk about the reasons why, most particularly that when you count caseloads by case, it doesn't account for when those cases are closed. So, I think every single person who really knows anything about public defense in Oregon knows that we want to get rid of MAC, but it's something that's really important that I think we continue to talk about at every possible opportunity, so that, especially to the legislature, so that we can make the eventual long-term but eventual transition away from that.
I agree, and I think that, and obviously correct me if you think I'm wrong, Jennifer or Lisa or anybody else. I think one way to present that in some detail to the legislature is that they seem to want data. And if we had a different model, the one that we've been recommending, it would be a model that could give them not only more data, but more accurate data. So changing away from the MAC model would be more useful to them, as well as being a much better way to operate. And I think that I was puzzled by the fact that they rejected a change from the MAC model when we had suggested one. And so I think that we have to be able to tell them how that change will be better for them. I don't know that they care about how it'll be better for us, but they probably will care about how it's better for them.
Yeah, and I think we're slightly off topic, but I'll just, I think we were met with this isn't a serious proposal response, because of the notion that the way it was interpreted was that we were walking in saying, tomorrow we want to do this model, including reducing caseload. So immediately you're going to make the unrepresented person's situation worse, because you're talking about taking fewer cases and needing more lawyers. And we didn't do as good of a job as we could have done to explain, like Washington is, that their motto is a 10-year proposal to do that. Ours was a 6-year proposal. And the cost, they looked at the cost at the end of 6 years and panicked, right? And said, this is crazy. We can't afford that. And interpreted that as we wanted that on day one. And so I think there's a way to thread that needle to going forward, to explain that is the better model for all the reasons that you've said, Susan, and some of the reasons that I've talked about, that also takes away that that explains it better too in terms of the budget, that it doesn't cost as much as they think it would over time. The way it was interpreted was, you want us to give you twice as much money as you have now today, and we don't have that money, when that wasn't really what we were saying at all. So I think that's a longer term goal for the commission, but something that I think that we need to continue to, in every opportunity, explain to the legislature, so that it becomes just the standard. They know coming in that everybody knows that MAC is bad and doesn't work, and that we need to move away from it, and that we need to move to a data-driven model. And that's what we should maybe start calling it, a data-driven model of public defense. Ken's good about that. He can come up with the language. Thank you very much. That's
Great.
very
Yeah.
helpful. Does anyone have any other suggestions about information that they think would be important or helpful that isn't included in the reports, or questions about what was presented? Okay, well, it doesn't sound like it. Thank you for your work, and thank you for the presentation, and we look forward to seeing the report.
Great. Yeah.
Okay, thank you. All right, moving on. Let's see, we have about a half hour. So moving on, next to the delinquency attorney standards and the beginning, just introduction of the parent-child representation standards. Mr. Arndt and Ms. Borden.
Yes.
Borton, not Borden, sorry. I knew that, I just slipped.
Good evening, Chair Nass, Vice Chair Mandelberg, and members of the commission. Last month, we talked a little bit. We presented initially the delinquency attorney performance standards. We had a little bit of conversation about the challenges with representing youth, and kind of issues around confidentiality and those sort of concerns. I'm wondering if the commissioners had a moment to review this. Does it address the concerns? Do we need to make some additional changes around that? I'm curious to hear the feedback.
I really liked your language. I thought it was great. I thought it really captured what I was talking about and the real tension that I discussed. And I thought that you did a really nice job of explaining that tension, and saying you have to pay attention to your client and do what you can't substitute judgment, but also acknowledging that you do have to talk to parents. So I thought that language was really great and captured really what my suggestions were. I don't know how other people feel about that. And just to remind people, the language that got added says the lawyer must explain to the youth, and where appropriate to the youth's parents or guardians, that the lawyer may not substitute a parent or guardian's interest or view of the youth's best interest for those expressed by the youth. So I think, as I said, I think that's great. Thank you.
Okay, wonderful. You'll see these again in December when they come back for a vote.
I think I thought we were voting on these particular ones
wait a minute.
in November.
You are correct. I took your earlier statement about, oh, I keep saying November, I need to say December. No,
I think this may
flipping it on
be,
you.
yeah, this may be the only action item. There may be one other, but this one is the only action item perhaps in our November meeting. But this is, we want to get these passed, and we've seen this now 3 or 4 times, so I think we're ready.
And you are correct. I'm going to move, unless there's another question on delinquency. Oh, go
I
ahead.
had a quick question, and
Yes,
then
sir.
it's just to the point that was just discussed. And this is again not my area of practice. So is the standard in Oregon the stated interest standard, or that it is a stated interest standard? Is that, and again, these are so thick that. Is that specifically articulated at a point that the standard is a stated interest of the child?
Yeah.
All right.
Yeah, it has to be a child that's capable of considered judgment. You have to follow the child's stated goal and the child's stated interest, and you can't substitute your own
Great.
or anyone else.
Yep.
Yeah.
That's great. Thank you.
And that's in dependency cases too.
Mhm.
which creates some interesting situations sometimes.
So that moves us to dependency, and this is the first time anybody's seen dependency. So I don't know how much of an opportunity people have had to review this, or if there are any initial thoughts on dependency. I want to make sure that we have enough time this evening for Ms. Borton to discuss the PCRP differences. I know there was a lot of discussion last month and concerns about, well, what are our enhanced expectations for PCRP providers? And she's really put a lot of work into that. And I want to make sure we get that on the record.
Could you maybe just briefly discuss the process that you went through? I'm sure it's probably similar, but the
Mhm.
process, particularly the outreach part that you went through for both the dependency and the PCRP standards.
Yes, ma'am. So when we start with the base standards are kind of the what the Oregon State Bar has, and then we reach out to the provider community, providers who practice in this area, and we cast a wide net and say who wants to be on one of these drafting groups, and they have a series of meetings throughout the year and draft what are going to be the proposed standards. And what we've done with each of these is we've developed the proposed standards and presented them to the commission. We've ensured to go back to the provider community and say, look, we know that everybody is not going to have time to sit in a meeting and be part of the drafting group. But if you have concerns with these, please let us know. Send us an email, get back to us. Let us know what your concerns are on these, and then we do outreach back to anybody who provides us any feedback.
Great. Thank you. That's very helpful. Does anyone have any questions or comments about the dependency standards? We'll have other additional time to talk about these and comment on them, but is there anything that jumps out? And these look, for anybody who's like reviewed the existing standards for representation that the bar put out many years ago, you'll recognize these. They're very familiar with those standards, just update a little bit. And I like the commentary. The commentary is helpful.
Mhm.
All right, it doesn't sound like there's any questions or comments off the bat. And I do want to make sure that we do bring them back again,
Mhm.
perhaps in one, because we have a small group here. I want to make sure that other commissioners who aren't here have an opportunity to weigh in or ask questions or make comments. So perhaps at one of the commission work group meetings, or we won't have a December evening work group like we are other months, but before the November, maybe before the November meeting or before the December meeting.
Okay.
Okay, and let's just move on to the PCRP piece then. And I know Commissioner Harris was who had a lot of concerns, and he's not here this evening, unfortunately, but that's okay. So let's talk about PCRP, Ms. Borton.
Thank you, Chair Nash, members of the commission. My name is Annie Borton, and I'm a resource counsel with the Trial Support and Development team, so part of Steve's team. And I've been tasked with kind of putting together the PCRP based on commission feedback and what we heard, putting together kind of a comprehensive overview of some expectations that we could add to PCRP attorneys based on understanding kind of what their contracts and their different model allows them to do. And so let me just share my screen real quick. All right. Are folks able to see that?
Yes.
Okay. And so, just a basic background for those who are not familiar, and this is all in the kind of the document that was drafted and submitted to you all. But the PCRP program, the attorneys are subject, they're all practicing in the same area of law, right? It doesn't matter if you are a PCRP or a non-PCRP county. The statutes and regulations, everything you're doing on a child welfare or delinquency case follow those same kind of rules and everything. The difference is in the contract model, and that a full-time attorney will carry an open caseload as opposed to counting on cases that come in. And so they carry 80 open cases at a time. If they're a full 1.0 attorney, they have access to case managers for 10 to 15% of their cases. And these are case managers that have a little bit more support than other case managers that might be accessible through our PAE system. So we have administrators who provide technical training and support for the case managers in these areas. And they also recruit, which really helps a lot in developing that program. And then their reimbursement rates are slightly higher. And then I thought it would be helpful to kind of understand what our contract lays out in terms of expectations of what all of our providers are following. So all juvenile attorneys are subject to the Oregon Rules of Professional Conduct, the state bar standards, the ABA 10 Principles of a Public Defense Delivery System, Exhibits B and C, and then the OPDC policies and procedures, which is where these standards and expectations would fall. And so the way that it would work is if adopted, the PCRP differences would only apply to PCRP attorneys, but PCRP attorneys would still be subject to the baseline dependency standards that everyone is subjected to.
And delinquency, right?
And delinquency, sorry,
Yeah.
yes. And so kind of before I jump into that next slide, what I tried to do, I actually created a table which has not been shared with you all yet, but tried to lay out what the juvenile standards are and then what the difference in the PCRP standards are so that you can really see what the difference is and understand what we're trying to do here. I think it's helpful to keep in mind that even with 80 open cases at a time, if you're an attorney working 80 hours a month or 80 hours a week, that's still only 1 hour per case a week. And so you're looking at 4 hours a month for those attorneys. So it's still, if you think about it, if you're putting all of your time into every case, touching every case, it's still, 4 hours is not a ton of time. But I just think that's helpful as you think through some of these standards.
Well, it's a half an hour. Because you're not working 80 hours a week. You're only working, you should only be working 40 hours a week, although we know we're not. But yes, I hear
Right,
you.
exactly. So if it's 40, right, you're getting 2 hours a month. And
Yeah.
so when you think about that, it's like it really puts some of this into perspective.
Yeah.
And 60 hours would be about 3 hours per month.
It's still a really high. I mean, I hear from PCRP lawyers all the time that it's still, even though it's a reduced caseload, it's still too high. Yeah.
So please break in whenever there are questions. What I did is break this down by each expectation. On the left side, you'll see what the black letter juvenile standard is, and on the right side is what our proposed PCRP expectation is. And so for this one, this is the child visitation specifically in a dependency case. The black letter rule is only that the lawyer must meet with the child client regularly and at least quarterly throughout the case. A lot of people interpret this to be in person. However, the standard doesn't actually require in person. It just says meet with quarterly. And so the PCRP expectation is in person at least every 6 months, in addition to these quarterly meetings, or at least 2 of those meetings be in person, and that you must visit the child when they're returned to parent. And you should visit when the placement changes. And then there are, we want to build in some exceptions for if you can't find the kid or they're not available, or it might be very harmful for some reason, that there are exceptions to not having to do these things.
So you're saying that the visit in person every 6 months is in addition to at least quarterly? Because
So
that doesn't make sense.
No, sorry, I misspoke there. So PCRP would have to visit quarterly every 6 months. So in essentially 2 of those meetings would be in person. So every 6 months, they just have to make sure that they're doing it in person. So it's still 4 visits. A lot of times it should be more, but at least every 6 months, they're putting eyes in the child and trying to looking at their placement ideally. If they're out of state, we said 1 time per year. And that's kind of the idea there.
I think if you're gonna have that chart, you should just clarify that first sentence, because the way I first read it, actually the way I read it twice was that it was less time.
I see. Okay.
Yeah.
I can clarify that. Yeah, no, this is everyone follows the left side and the clarification is on the PCRP.
Yeah, got it.
I'm sorry, can you just
Sure.
state that again simply for me? So the black letter rule is quarterly, but that could theoretically be remote. The PCRP standard, which is elevated, should be once every 6 months, but in person?
So
Or
the PCRP standard would be quarterly and at least every 6 months in person. So you're still meeting that same quarterly expectation of contact and visits, but twice every 6 months you're doing that in person.
I mean,
It's
it
building
kind of
on
begs
top of
the
it.
question about why aren't you meeting quarterly in person? And why do we have that as a standard? I mean, we probably should have that as a standard. I mean,
Yeah, I think there's some good questions there. The other thing to keep in mind is that a lot of attorneys don't actually do these personally, and the PCRP expectation is for the attorney to do this visit themselves. And so we do know that in many places, the attorney is sending staff or other members of their team to meet these visits there instead of going themselves. And so that is also the part of the PCRP expectation, is that the attorney is expected to do these.
okay, so I think that's fair. So I think a better way to maybe say that PCRP expectation is that the lawyer or the lawyer's representative must meet with the child client at least quarterly, and the attorney must meet in person, and the attorney must meet with the child at least once every 6 months. I think.
Yeah, and I should have
and
clarified that that is written out, I think, more clear. I'll make sure it's more clear, but these are paraphrased for your ability to see them on my screen. But that is, yes, that was the language we attempted to lay out, but I'll clarify that and make sure that it that is clear in the actual document and these
And then I
terms.
think, in the dependency, I mean, no, I think in the regular juvenile standard, I mean, somebody ought to be meeting with, I mean, in remote is fine, but I think it should say child client's lawyer must meet with the child client at least quarterly throughout the year. So that's probably fine.
And there is and so I only included the black letter rules here, right? There is commentary that makes recommendations and suggestions for best practice, but I think another thing to think about is what's an actual requirement versus what's a reality of a practice and a best practice. And so, a lot of attorneys are doing some of these things, but we're also thinking about what are our standards and what do we want to make the absolute requirement.
Well, I mean, you and I both know that there are a lot of kid lawyers that don't see their kids ever. I mean, I know that foster parents in non-PCRP counties who are surprised sometimes when they get a different kid lawyer in, and that kid lawyer wants to start visiting kids and start visiting kids in resource placements because they say they've never had lawyers come visit. I have that happen all the time. I've never had a lawyer come visit a kid here. So that happens more frequently than we want to talk about. So I think we need to have it in the standard that they need to visit their kids and have it be an expectation.
I will put that in our notes here for adding that in. The next expectation too, so this is for delinquency clients. And so again, the black letter rule still applies to PCRP, and then the PCRP is building upon that, so that the black letter rule for everybody in the delinquency standards is you must conduct an in-person interview, and in custody it should be no more than 2 days after your assignment. If it's out of custody, you just have to make contact or attempt to make contact 3 days. And then there's rules around post-adjudication, communication, and contact. And the goal on the PCRP was to say you have to meet in person in a confidential setting once per month and must have at least one confidential conversation between meetings. So the idea being you are meeting regularly pre-trial, pre-adjudication, I should say. And finding ways you should be able to have a conversation over the phone. Most of the juvenile facilities should be able to facilitate that. But giving your client the opportunity to share information in a confidential setting is important. And then for post adjudication, the expectation is that you would regularly visit your client, similar to the dependency standard, at least every 6 months, and maintain contact between visits. And then for out of custody youth clients, it's attempt to regularly hold meetings with youth, and then hold or attempt to hold at least one meeting every 6 months, and then maintain regular phone or text contact with youth.
And that, yeah, post adjudication. I remember when I first read it, I didn't see the post adjudication at first, and I was like, what do you mean once every 6 months? So, yeah.
Yeah, because there are a lot of times in a more settled program, it's great you want to keep an eye on things, but it's a very different kind of posture in terms of what's going on with them. So this is attendance at substantive client meetings. And this was actually a direct response to what the commission talked about last time. There is no actual requirement to attend any meetings at all as part of our dependency standards or the Oregon State Bar standards. And so the idea of this is a substantive client meeting is something that's going to impact your client's case or their ability to meet the court's expectations. So we think of these a lot in dependency, like meetings with your caseworker, your RAP meetings, which are if you have a child with multiple systems that they're involved with, they have a RAP team that discusses the child's plan. It's a kind of a cool program, but the attorneys often don't go, and it would be great if they did go. Family decision meetings, that's what the FDMs are. Those are with DHS caseworkers and a lot of other parties that really discuss kind of the substantive issues within a case for a dependency case, like return home plans, parents' progress, things of that nature. And then substantive meetings with your juvenile court counselor. So those are delinquency cases. Juvenile court counselor has a lot of authority and control over a youth in terms of their release, kind of expectations, and then if they're on supervision, kind of what their supervision plans will look like. And then we wanted to kind of have a catch-all because each case is a little bit different, and you have meetings that are important that attorneys should be attending. And so the idea of this was that they should be attending most of these meetings, and there can be a lot of them, and we tried to kind of clarify that it really should be the attorney with the client and not other staff members, because that is what happens most of the time, is that case managers, investigators, and legal assistants are covering these meetings in many counties. This is a dependency specific one, citizen review board hearings. So I'm not sure if everyone is familiar with these, but in a dependency case, unless the court decides to cancel them, which they can do, there's what's called a citizen review board, which is a group of volunteer citizens who come together to review kind of DHS's work on the case. They have a list of questions and standards that they work through, and they're basically evaluating if the agency, DHS, is meeting the requirements kind of that they have laid out. These are things that are often not attended by attorneys in many areas. And so the idea in PCRP is that the lawyer must attend the CRB. However, we've also heard from many counties that the CRB is not willing to work with attorneys on scheduling. And so we wanted to build that out to say, you have to try and reschedule. If you can't, then you can send somebody else to be a part of it. And again, there's no expectations on these, but we would expect there's no dependency requirements. But as part of this, you would want to be prepared. And so you should be meeting with your client before and after the CRB to explain what happened, kind of go over it and see how you can use it or if you can't use it and to benefit your case. And I see we're running, I'll run through these a little faster because it's 6:25. An expert engagement letter. This is just the idea that you write down what you expect from your expert, so long as you don't include any confidential information or information that you wouldn't want in writing, such as hey, my client's made some comments about this other thing. If before you write a report, can we talk about that to see if I want you to write a report? You wouldn't want to include that in any engagement letter, but we like the idea of setting out clear expectations and deliverables for an expert. Client engagement. This really is independency of the standard is basically around visitation. The idea of this is that the attorney should be meeting more regularly and talking with the client about important decisions, not just around kind of court dates and everything, but things are happening in their case. You should be engaging with your client regularly when big things are happening and having those substantive conversations. The delinquency release preparation for in-custody youth. The idea here was to put a higher expectation on the documentation and the work that you're putting into the release arguments that you're making in a PCRP county. So the idea that you're, these are basically taken from the commentary and made an expectation. So that you are talking with the youth and really working with them and their family to develop a comprehensive plan to put forward to the court, as opposed to making an argument without any of this background to the court, which often happens. And then PCRP, as I mentioned before, has the case manager portion. So 10 to 15% of cases, we contract to provide case managers on 10 to 15% of cases. There is no requirement right now, of course, in juvenile non-PCRP because they don't have access to case managers regularly. They can use the PAE system. However, case managers don't really exist except in a few counties. And so they're hard to locate and they're not managed at all. And we also know that not all PCRP attorneys use case managers. And so by building this in as an expectation, it is really to encourage one of the key components of the program, which is that all attorneys are using the case managers. And then this ties in with the next one, which is that they actually have to be effective in their use of the case managers. And this was actually a request from our case managers of having more clear guidance and expectations for the attorneys around how to appropriately work with a case manager. Making sure they're sharing discovery, sharing court dates, and working collaboratively, as opposed to just saying, oh, I have a case manager, they're going to deal with these things.
Is the 10 to 15% a realistic number? That seems really low.
That's what we're around that level in terms of our contract.
Okay.
So.
Okay, thank you.
And then this is just a kind of a program specific. The rest are kind of program specific. So we figured we would put in an expectation of making sure you're doing your time correctly and submitting it in a timely fashion. And then this is sort of tied to the KPM, which may be going away. But if the current KPM of a third of your time being spent with a client who has decision-making capacity is not going away, we wanted to make it an expectation in terms of how, that they are kind of meeting this. But alongside that, if it were to stay as part of our KPMs, we would also make sure to update and ensure everybody knows how to report accurately what client time means. And so it's not just confidential client time, but it should be those times that you're sitting with your client and advocating with them when you're in a CRB, when you're in, well, not a CRB, that has its own category, when you're in a family decision meeting, or you're meeting with the juvenile court counselor and your client. Those are all times that you are building your relationship with your client and demonstrating your advocacy, and are part of the reason that this metric came into being in the first place. And so if this does stay in, it would come with that modification and clarification of how to appropriately report your client time, which we think would increase how many people are meeting that metric.
I think that makes sense. Rather than eliminating the metric, make sure that the definition of what client time means to include times when you are physically accompanying your client to meetings, etc. So, because I mean, it is a good metric to have so long as it's updated to mean all the time that you're spending in meetings and things like that too.
Yeah, and that's what we find is that a lot of the times when we look at our attorney reports on time, everything is falling into the other category. And so
Right.
because that's the catch-all. And so if we can clarify and kind of pick this back up and kind of get back to what do we want to see and why is this program important and different, some of these things, I think having them match what our goals are is going to be helpful in demonstrating why they're useful. And another part of this that in past reports, the way we've talked about it is we have this as the KPM, but we also add as a note or kind of a comment how much time our case manager is spending in addition with these clients. And so it's not the KPM is attorney time, but the client is getting more time with individuals that are their advocates, which is a really helpful, which is kind of the purpose of this metric of demonstrating and why it was taken from Washington was the more time you spend with your client and building that relationship, it helps with your outcomes, client satisfaction, you know your case better, you're able to make better arguments, and it can just be helpful overall.
I just wanted to add that it seems to me like it would be an important standard regardless of the KPM. So whether or not the KPM remains or goes, keeping the standard, I think would make a lot of sense. And I think that, in terms of what I understood the main criticism of having a tiered system of juvenile representation, it certainly is. It's measurable. It's a practice standard that we can enforce and we can see. And so I think it's just seems like a really important standard regardless of the KPM.
Yeah, I agree. And just updating what the definition of client time is. We'll fix the metric. And that's pretty easy to do. But I agree. I think it's good to keep it.
And then this is just there's more oversight in PCRP. So we have meetings regularly with PCRP and that the expectation is to attend the meetings, which I will say most people do this. It's harder in bigger counties because attorney schedules are more difficult, but we do tend to have good turnout at these, but it's also important to kind of make it a part of the program as you meet and kind of see what's happening. In these meetings, you get updates from the agency, you go over caseload numbers, kind of case manager issues, and it gives a good overview and kind of how the county performance overview, both from our perspective and from hearing from the providers directly about what's going on, which is very helpful. And then that is the last expectation. The other piece I want to say is we have not shared these this has been a fast process in developing these. So sharing them with providers has not quite happened yet. They've been published, but we really just finished drafting them pretty recently. Our goal is to hold a town hall feedback session the end of November, the last week of November, and get provider feedback, because I know that we will definitely have provider feedback on a lot of these. And then take also commission feedback and then kind of keep moving these forward to a place that we can get a finalized draft, assuming the commission still wants to go in this direction.
Okay, so that's great. I know we're a little over time, but let me just lay out kind of a timeline based on that. So you're going to have a town hall meeting the end of November. We can present these and kind of the feedback. Do you think it's too much of a turnaround to do that on December 5th at the work group before the commission meeting on the 5th? If it is, that's fine, but you'll have to wait until the first week of January, and I don't have that date right now, but we will in November. We'll have that's the other action item, the commission calendar meeting in November. We'll have that. You'll see what that date is in early January. That might be when you need to, and I'm okay with that. You need to bring that back in January for the work group meeting, and then it would be ready probably. You probably wouldn't be ready to vote on it until February then, if that.
Commission feedback incorporated as soon as possible. And so our hope is to have as much incorporated by December, but we also want to rush things too much. I also am going on leave for about 3 to 4 months in December.
Okay,
And so I want to get as much of this done before I take my maternity leave. So
okay,
that is definitely my goal, is to
Okay.
get as much done as possible, and then basically have it be kind of the stuff on the margins that people can kind of go back and forth on. But the majority of the work hopefully will be done end of November, beginning of December.
okay, great. Then I would think would probably be ready for voting in January then. We would have seen it enough times, but we'll check. Well, thanks for your work. That's really great. I really appreciate it. And it's very helpful. Your side-by-side chart, I think, is really helpful. Although I will say, just as kind of an editorial comment, I mean, really what everybody should be doing is on the PCRP side, and it kind of highlights that glaring, like, yikes thing, which is probably exactly to Commissioner Harris's point. So we'll hear more about that during the next commission meeting, I'm sure. But thank you for your for your work. Really appreciate it. And we will see you again in December to talk about this. And I'm going to also, unless anybody has anything else to say, adjourn the meeting for the evening. Thanks for your time, everyone. All right, see you in a couple weeks at November meeting. Thank you. All
Take
right,
care, everybody.
bye.
Bye.